Hi, Jim McKinnell here, Director of the Office of Pre-Health Professions Student Development at the University of New Mexico. If you've joined me before, welcome back. If this is your first visit, well, welcome. I actually just got back from having my hair cut. Kind of curious. As I was sitting in the chair, I was very aware of the way my barber was moving around me. A lot of times I know that a lot of us, when we go to get our hair cut, there's a little bit of even anxiety associated with that. Like, oh, what's it going to look like? Is it going to look the same as it did before? Is it going to be horrible? And so we're a little on edge when, or at least I am. I sometimes am a little on edge when I sit down in the barber chair. But today I was really comfortable. I felt very relaxed, actually. Especially when my barber, his name's Isaiah, especially when my barber sort of took a step in front of me and actually looked at my head to sort of see what my haircut looked like from the front. And he looked at it very critically. And I found that incredibly reassuring. And it suddenly occurred to me that I felt very much like he was taking care of me. And that got me thinking about the whole concept of care. And I've talked to students about this before, but I think it's worth having a little chat about that concept, because it's central to all the careers that we all aspire to. So what does it mean actually to take care of someone? It's really an incredibly complex kind of concept, because a lot of times we think, well, if we're thinking simplistically about wanting to be a doctor or wanting to be a nurse, taking care of someone is helping them, sit up in bed, helping them eat, keeping them pain-free. As a physician, making a diagnosis, giving them a prescription, making sure the prescription has been effective. And that becomes our concept of care. But I think the reality of it is obvious, is much more complicated than that. Take your own experiences with having someone take care of you. I always see the little picture of a little 2-year-old running along and all of a sudden tripping and taking a header and clunking their chin on the sidewalk. Chin splits open, blood's going everywhere. And in my mind, I see a little mom running over there and with a washcloth and holding a washcloth on the chin, and little guy's crying, and mom's like, don't worry. And we always say nice things, and we clean up the blood, and we put a Band-Aid on it, and we give a little hug, and we feel cared for. The other extreme, I think, there are times when sometimes we walk into our house and we're just kind of irritated. Nothing's gone right, and people have been mean to us, or have been disrespectful to us in some way, and we just feel frustrated because we don't know how to respond to that disrespect, and so we storm into our house, and we have a loved one look up and say, "What's going on? What's happened?" And all we do is yell at them, "Just leave me alone!" And we march off into our room and we slam the door, and we sort of stew and calm down. And later, when we come out and we have a chance to talk to whoever that person was that received our wrath as we were walking into our room, we have a chance to sort of explain a little bit about what happened. And interestingly, they're still sitting there and they still love us. And that also, that permission to be a creep, that permission to sort of be angry and to sort of have your own space and to demand to be left alone, the permission to do that, the respect, having people respect that need, is also being cared for. And so I think, so you can see that there's this huge spectrum of what that actually can mean. And I think that when we think about medicine in its most simplistic form, we think of a person who's coming in sick, sitting down in a chair across from a doctor. Doctor says, "What's going on?" The patient gives the doctor the story. The doctor says, "Oh, it sounds like this. Here's a prescription." We hand the person the prescription. They go off, and we have done our job. We have taken care of them. But I don't know. A lot of times when I have that kind of an encounter with my own healthcare provider, I don't really feel cared for. I feel like they didn't really have time for me. And so when I think of my own needs, of what I feel, what I need to feel cared for, a lot of times I need to feel listened to. I need to feel like someone has the time to hear me. I need to feel like someone's paying attention, like my barber Isaiah did this morning. He really paid attention to me, and that made me very, very calm. That really gave me that sense of feeling cared for. So for those of you, which is basically all of you, who are interested in careers in healthcare, I think that it's a really, really important thing to sort of take a little time, invest some effort, and understand what you think being cared for means and how different it can be from situation to situation. Think of your own experiences. And also then, after you've gotten through your own experiences of being cared for, I want you to think of the times that you've cared for someone. Many of us, many of us have had opportunities to care for people. A lot of times the people that we're asked to care for are family members, people that we care about, people that we've grown up for, people that we love. And it is important. I mean, that's our experience. And we know how sometimes it's really easy to care for someone because we love them, and we know sometimes how difficult it is for care for someone, especially when they're sick, because now all of a sudden this person that we love is all crotchety because they don't feel good and they're sort of mean to us, and they don't appreciate the fact that we've made an effort to get them soup and fluff their pillow and all those kinds of things. But we still come back and we still take care of them because in spite of all their nastiness, in the face of our efforts, we still love them. Well, going into healthcare, your job, every single time you walk into an office, every single time that you sit down across from someone you've never laid eyes on before, a total stranger, your job is going to be to take care of that person. And so I want you to sort of take your own experiences of caring for family members, people that you've known and loved, and I want you to think how different that would be if you don't have the emotional investment there. So we don't have those ties. We're not automatically as forgiving because this is someone now that we've never met before, that we just have no connection to. I'd also like to suggest that maybe the first step in actually taking care of someone is making the effort to make that connection, of making the effort to sort of have a conversation with someone, understand who they are, not just what they're suffering from, not just, they're not just their symptoms, but understand, who they are and understand the context that those symptoms exist in. None of us are just our symptoms. None of us are just our backache or our sore throat. We have lives where those symptoms exist in a person, and that person exists in a world. And sometimes those symptoms, if my back is so sore that I can't come to work, and I'm the only provider for my family, that means that my back, that symptom, yes, it's causing me discomfort, but the discomfort that I'm feeling is in my back, but it's also in my heart and in my head. Because now I have concerns about not being able to go to work and not being able to be paid because I'm missing work. And that results in me not being able to provide for the people that I love, to pay my rent, to pay my car bill, my car payment, to put gas in my car. So the context is that those symptoms exist in that world that individual lives in, and the ramifications that this individual's illness or health condition is going to have, not only on the individual, but then everyone in that individual sphere, everyone that's part of that person's life. That's really important for us to understand, because in order for us to really take care of that person, not only do we have to understand their symptoms, but we do need to make an effort to understand the impact that the individual's illness or condition is going to have on not only on them as individuals, but on their life, on the people around them, on the situations in their life, and how that illness is going to impact on all of those things. Really, really important to understand. And if we make the effort to do that, if we make the effort to understand, even though we may not be able to do anything about it. But if we make the effort to understand, just asking, just listening, being interested, exploring those things, taking the time to explore those things, taking that attention to detail, that is going to go a long way in helping our patients feel cared for. It's an interesting thing to talk about. And I want you, as you move through all the activities that you're doing to prepare yourself, we're trying to be the best pre-health profession students we possibly can be. And we know that, we're going to do volunteer work and we're going to do shadowing. Well, as you're shadowing, as you're watching those healthcare providers do their work, I want you to think about that question. What efforts are they making? What am I watching? What am I hearing? What are the efforts that this individual is making to take care of his patient? And as you're in a volunteer experience, I want you to also think about that as you're interacting with people. Is what can you do to take care of the people that you're interacting with? Interesting challenge. Early on. So today's kind of a chat day, but I like to sort of just share some of the things that I'm thinking about, because I do think that these concepts are very relevant to sort of healthcare as a profession. And since you're aspiring to those kinds of those jobs, since we all want to be in healthcare, I think that it's really, really important to be aware of those things, to be thinking about those things, because in a couple of years you're going to be sitting across from the table from someone who's going to be making the determination of whether or not you get accepted into medical school or nursing school or whatever program you want to go into. You're going to be sitting across from the table from that individual. And they may ask you why you want to be a doctor. I don't love that question, but instead, I'd like you to think about the question, why do you think you'd be happy taking care of someone? Half of that question, half of the answer to that question is that whole concept of taking care of someone. What are the experiences you've had? What have you witnessed? And why do you think you'd be happy doing that? Okay, guys. Next time we'll try and get a little more hardcore content for you, but thanks for giving me the opportunity just to chat a bit. Jim McKinnell, Director, Office of Pre-Health Profession Student Development, the University of New Mexico. This is Planning for a Career in Healthcare. Please subscribe, share with your friends. I'll see you next time.